Please, let's welcome them, starting with, ladies and gentlemen, Dr. Rajaie Batniji. W. Gregg Slager. Dr. Lisa Bielamowicz. And Rosemarie Day. Thank you all. You can all have a seat. And now we're going to begin the debate proper. I just want to remind you again about voting. Go to the URL IQ2US.org/vote. Vote for, against, or undecided on the resolution, Retail Alliances, Not Washington, Will Save the U.S. Healthcare System. So I'd like to officially launch. So if you could one more time give me one of those spontaneous rounds of applause, I would appreciate it. Traditionally, we who go to doctors and who buy medicine and who check in and out of hospitals have been known as patients. But somewhere along the line, we patients started to be called consumers, a term that suggests things like choice and competition and value for money. And if we are consumers of healthcare, then who would know best how to provide to these consumers? Well, in the last year, we've seen a sudden surge of consumer-oriented companies trying to figure out how to get into healthcare in a big way, like Amazon partnering with a bank and with Warren Buffett with plans to figure out their own healthcare system for their combined million-plus employees, like CVS, the pharmacy, buying Aetna, the insurance company. Their idea, they say they know consumers, they know data, and they know how to deliver value. Are they onto something? Well, we think this has the makings of a debate, so let's have it. Yes or no to this statement: retail alliances, not Washington, will save the U.S. healthcare system. I'm John Donovan, and I stand between two teams of two who are experts in this topic, who will argue for and against the resolution. As always, our debate will go in 3 rounds, and then our audience here at the Mayo Clinic's annual Transform Conference in Rochester, Minnesota, will choose the winner. And as always, if all goes well, civil discourse will also win. One more reminder to the audience. Please cast your pre-debate vote, IQ2US.org/vote, for, against, or undecided. We're going to keep that vote open for another minute or 2. And I want to explain now, after you've heard all of the arguments, we ask you to vote a second time. And we name as our winning team the team whose numbers have moved up the most from the first vote in percentage point terms. So it's the difference between the vote that you've just cast and the second vote. Our resolution, Retail Alliances, Not Washington, will save the U.S. healthcare system. Let's meet our debaters, starting with the team arguing for the motion. Please, ladies and gentlemen, welcome Rajaie Batniji. Rajaie, welcome to Intelligence Squared. You are a physician, you are a political economist, you are the co-founder and chief health officer at Collective Health. But before all of this, you spent a lot of time in academia. You studied history at Stanford, you went to med school, you studied political economics at Oxford. So tell us, why did you leave academia to start a startup?
Impatience. In all seriousness, creating a company to create the change that we need in the healthcare system allows us to move at a much faster pace than, frankly, writing a paper and hoping it lands in the right desk.
And has it been worth it?
Absolutely.
All right, good to hear. Ladies and gentlemen, once again, Rajaie Batniji. And Rajaie, you have a worthy partner. Please welcome, ladies and gentlemen, Gregg Slager. Hi, Gregg, and welcome to Intelligence Squared. You are a senior partner at Ernst & Young, global health transaction leader, and one of the founders of the company's global health sector. Back in 1979, you were a business major in college, and you won the Calvin Talent Show's grand prize. For doing what?
Well, it was a rock and roll band at a conservative school that was used to a cappella choirs and barbershop quartets, so set off quite fireworks.
Shook things up, it sounds like.
Yeah.
All right, good to hear.
Good fun.
We'll see how you shake things up here in this debate. I want to once again thank the team arguing for the motion. And of course, we have 2 debaters arguing against it. Please first welcome Dr. Lisa Bielamowicz. Lisa, welcome to Intelligence Squared. You are a physician. You're co-founder and president of GIST Healthcare. You have said that you are passionate about increasing the pace of transformation in healthcare. Passion is a strong word. Where does that come from?
So like almost every physician I know, when I was clinically practicing, I was frustrated on a daily basis that the system kept me from being able to do what I thought was best for patients. And like almost every doctor I know, I complained a lot. And I finally had a moment and said I could keep complaining or I could start to change how the system works. So that's what I'm trying to do.
Something in common with one of your opponents, actually. Okay, Thanks again, ladies and gentlemen. Lisa Bielamowicz. And one last opponent, again, a worthy debater. Please welcome, ladies and gentlemen, Rosemarie Day. Welcome to Intelligence Squared, Rosemarie. You are founder, CEO of Day Health Strategies, and before that, interesting government work. You were the founding deputy director and chief operating officer of the Health Connector in Massachusetts, and chief operating officer for the Massachusetts Medicaid program. Your forthcoming book is titled Get Woke About Health Coverage, Action Steps to Take for Yourself, Your Family, and the Nation. So tell us, in this context, health coverage, what does it mean to get woke?
It means that we need to get informed and we need to get active.
Simple as that.
Simple as that.
Okay, ladies and gentlemen, the team arguing against this resolution. And so let's move on to round one. In round one, we have opening statements from each debater in turn. The resolution again, retail alliances, not Washington, will save the U.S. healthcare system. Speaking first for the resolution, and you can make your way to center stage, please welcome Gregg Slager, senior partner and global health transactions. I'll do that again because we can always edit. That's a gift that I have that you don't. Gregg Slager, senior partner and global health transactions leader at Ernst & Young. Ladies and gentlemen, Gregg Slager.
Thank you, John. When we talk about saving healthcare, what we're effectively talking about is achieving the triple aim, reducing unsustainable cost, increasing access to care, and improving clinical outcomes. My partner and I believe that retail alliances, which are the convergence of healthcare with retail, technology, and consumer product companies, and not government, are capable of changing the system and saving healthcare. We all have a lot of pain in the system. We've all experienced that. I won't take you through it all, but we have the fragmentation of care. We have information silos. We have difficulty in getting access to care and getting appointments. And then the bills come in, too. And they keep coming in, and you can't figure them out, too. But that's because we have costs that are out of control. With respect to the cost, too, you know the statistics, $3.3 trillion in healthcare expenditures in 2016, 18% of our GDP, $10,348 per person. That's not per family or per county. That's per person that we spend on healthcare. It is out of control. And the sad thing is that outcomes rank last against comparable countries in similar developed nations with similar economics as ours too. We are last. Have the highest mortality rate amenable to healthcare. We have the highest error rates. We have the longest wait times, with the exception of Canada. And then we also have twice as many avoidable emergency room visits as any other country. One of the things that John mentioned is the rise of consumerism, and we think that this is a really important facet here. So we have been trained. We've been trained by our online experience and what we want out of a consumer interaction. And we want that experience in healthcare, too. So what customers are looking for, they're looking for choice. They're looking for choice in care. They're looking for quality. They're looking for costs. And we don't have that now. We don't have that transparency, too. So the government isn't very good with consumers. When's the last time you went to your DMV to try to get a license? You want to see the consumer experience there. So we need new delivery models. The old ones aren't working. And our position is that consumer-centric retail alliances will help drive access and convenience, enhance the customer experience, and actually kick up innovation as well. You heard about some of this earlier too on the stage at the beginning of the session here. So retail health models, they're a key step to cost-effective care anytime, anywhere. Retailers have scale. They have the ability to make these changes. They can also activate through multiple channels. The engagement that they have with their customers is through their stores, through their clinics, through their doctors, through their nurses, through their websites, through their apps, through the email, through the text, and even old mail too. We still get those flyers in the mail I'm trying to get rid of. The other thing is innovation. With innovation, tech and consumer product companies are creating amazing devices, wearables, implantables, digestibles, things that can measure many of the vital signs that can give early indications of care conditions or diseases. Same thing with apps. We have 200,000 apps out there. You have apps now that can diagnose your disease by coughing into them, or they can tell by your gait when you're walking on your carpet whether your gait is impaired and what that may lead to. It also can measure your care adherence. It also can tell if you've fallen down, and it can help you get the appropriate help too. So I'm not saying that government doesn't have a role here. Government has a very, very important role, but it's to support retail. It's to support innovation. It's not to drive the cart. It's to help push it too. They need to get behind promising initiatives. They need to also align incentives. And then, most importantly, they need to put the infrastructure in place to gather evidence to implement appropriate regulation. Because what we need in our transforming business right now is we need regulation at the speed of innovation, not innovation at the speed of regulation. So in closing, I would say that the retail alliance advantages are many. They have the appetite and the will. They have the appetite and the will. Does government have the will to change the system, to make the changes necessary here? They aren't encumbered by the legacy costs and the legacy inefficiencies, the inertia that's caused by all those people that profit off the inefficiencies. They also have previous experience in the adoption and use of technology, which is really important for this business. It is a laggard from an industry perspective too. And then the customer centricity and engagement, which can actually nudge people into healthy behaviors, into healthy choices as well too. So lastly, they are agnostic to politics. It's not going to change every 4 years. It's not going to change every 2 years. These are ongoing long-term investments to really make a difference in the healthcare system too. So it's time for a new approach to healthcare. And I hope that you will support our proposition that retail, not Washington, will help save healthcare. Thank you.
Thank you, Gregg Slager. And that is our resolution. Retail alliances, not Washington, will save the U.S. healthcare system. And here to speak first against the resolution, please welcome to center stage Dr. Lisa Bielamowicz, co-founder and president of GIST Healthcare. Ladies and gentlemen, Lisa Bielamowicz.
Well, I'm going to start with a little self-help moment. Hello, my name is Lisa. I'm a doctor, and I take my kids to the CVS Minute Clinic. It happened 2 weeks ago. You know how it is. Your kids start school, have an elementary school student, 10-year-old in 5th grade. She comes home 1 weekend, Friday evening, sore throat, fever to 102. You guys tell me, what does she have? Strep throat, absolutely. It's Friday evening. She needs antibiotics. I don't prescribe anymore. So, of course, the doctor's office is closed. So what do we do at 8 p.m.? We go down to CVS, we put our name on the list, we mill around looking at magazines and hairbrushes for the better part of an hour. We get seen by the nurse practitioner. We are out in an hour and a half, antibiotic in hand. She's back in school on Monday. Seems like it was fantastic, right? Now, while I was sitting there, I was remembering that I am going to be coming to you and defending the negative, that retailers aren't going to be the ones to transform healthcare. So I started thinking, you know what? There was something with this visit. It hit a very important value proposition. It was convenient. But was it going to the doctor? Is it going to replace my daughter's pediatrician? Absolutely not. You know what it felt like? It felt like we were meeting with the nurse across a card table in a broom closet in the back of CVS. So, served a point, but is it truly transformative? And I'll be the first one to admit that I am not up here to convince you that Washington and the government is going to be the main change agent, but I want to give you some thoughts about what retailers would have to do if they're going to truly transform healthcare. I think there's two things that are really important. Simply, are they in it to really change the system? What's their motive for getting into healthcare? And then second, are they going to tackle the really big problems and the big cost drivers that are the reason that we are 30% more expensive than the next highest spending Western country? And more importantly, will patients like you trust retailers to help them make those big healthcare decisions? So I've been really blessed in my time working in healthcare to get to work with a lot of providers, doctors, hospitals, health systems, including Mayo Clinic, as well as several of the major retailers. And I've gotten an inside window into their strategy in healthcare. Take CVS. These guys have been at it for a long time. Did you know the first Minute Clinic opened here in Minnesota 20 years ago? They are still doing the Minute Clinic thing, haven't really expanded much past it. You talk to them and you say, well, why haven't you been able to grow this as quickly? Well, we've been testing out different business models. We're not sure where we want to go with it. And we have found real obstacles to grow right inside the store. You know who their biggest obstacle is? The store manager. That guy is bonused on revenue per square foot, how much dog food and shampoo you buy when you are in CVS. He doesn't like a dozen people with the flu mingling around in the back of the store. Now take Walmart. I spent some time with them in Bentonville, Arkansas. Walmart will tell you, why are they interested in healthcare? Yeah, there's a lot of money there. They think they can make money on it, but they're more concerned about you and how much your healthcare costs. They think we are spending so much money as individuals that it is hampering our shopping power. They think if they can lower healthcare costs, they could, in fact, increase their revenue by 3 to 5%. They want to get into healthcare so that you can buy more junk from Walmart. That's their value proposition. It goes back to the same retail game. Quick care leading to quick profits. Any of us who've been in healthcare know that change doesn't come quickly. It's frustrated venture capitalists. We're not like any other industry. They come in, they want to turn profits around quickly. Doesn't happen. Retailers are going to get frustrated. And if they're going to really make a dent in healthcare, it can't just be about primary care. That's 7% of total healthcare spend. I think we all agree it should be more, but it is what it is. It can't even just be about pharmaceuticals. That's about 10% of healthcare spend. You have to tackle the big stuff. Hospital care, specialty care, the 10% of patients who account for 80% of costs who have really big, significant problems going on. And I started to think about that visit to the Minute Clinic. We all trust CVS or Walmart or Walgreens or a virtual interaction with a retailer when we pretty much know what's going on. I knew my daughter had strep throat. Shoot, you knew my daughter had strep throat with one sentence. But I would ask you, if they're really going to transform healthcare, are they interested in figuring out which hospital you should go to? Are you interested in having them tell you which hospital you should go to? So to vote yes, you have to believe they're serious about that and that you would trust them to be your partner when it's your turn to walk through the hospital door. Thank you very much, and I hope you will consider our defensive position.
Thank you, Lisa Bielamowicz. And a reminder of where we are. We are halfway through the opening round of this Intelligence Squared US debate. I'm John Donovan. We have 4 debaters, 2 teams of 2, fighting it out over this resolution. Retail alliances, not Washington, will save the US healthcare system. You have heard the first 2 opening statements, and now on to the third to debate for the resolution. Retail alliances, not Washington, will save the US healthcare system. Please welcome to center stage Dr. Rajaie Batniji, co-founder and chief health officer at Collective Health. Ladies and gentlemen, Rajaie Batniji.
Nobody knew healthcare could be so complicated. So explained President Trump last year. He continued, let it be a failure. We'll blame it on the Democrats. Ladies and gentlemen, Washington is broken, and a broken Washington cannot save our healthcare system. The results speak for themselves. Washington responds more to the interests of pharmaceutical companies, big health insurers, and hospital systems than it does all of us who are accessing care. Hospital payments since 2000, up 60%. Pharmaceutical costs, up 69%. We see, I looked last night to look at the stock price of the major publicly traded health insurers, 300% of where they were just 5 years ago. Now, this isn't a red state issue or a blue state issue. It was a Democratic administration that took affordability out of the Affordable Care Act and gave a multi-year, multi-billion-dollar concession to big insurers so that they would support the bill. It was a Republican administration who gave up Medicare's ability to negotiate drug prices for seniors. The result? Insulin, which cost $20 a few years ago for a senior, the same medication now costs that senior and his payer $700. Now, Washington is broken. Can we trust it to fix healthcare? There are two beacons of hope that I see. The first is the American employer and the alliances that employers are forming today. Keep in mind, American employers are paying 88% of private health insurance costs, 88%. And when they pay for health care, they're paying at a rate of 189% of Medicare, according to the Congressional Budget Office. So employers have effectively become the piggy bank that is financing the runaway growth in healthcare spending in this country, paying for that proton beam machine the hospital didn't really need because there's a very suitable one right next door, paying for that fancy new wing. And this cost comes back into our Medicare costs and our Medicaid costs because now the federal government also has to keep these hospitals afloat who have built these institutions of exploitation to get more revenue from the private sector because they were unchecked and unrestrained. Employers are beginning to take action. And I see this in what Amazon, Berkshire, and JP Morgan are doing. And when Warren Buffett says that he and his fellow CEOs are attacking the hungry tapeworm that is eating at the American economy, they mean it. And every CEO in America has woken up and begun to pay attention to their healthcare costs, recognizing that we can move from a system of healthcare that is sponsored by employers to one that is driven by them, that goes towards outcomes, that focuses on improving the health and wellness of our people and the bottom lines of our economy. There's another beacon of hope, too, that I see, and that is what we've seen in retail. Like employers have an incentive to drive towards radical transparency and direct first dollar payment, so too do retailers. Right here in Minnesota, we saw for the first time that retail clinics produced costs that were 40 to 80% cheaper than urgent cares or primary cares in a study, and with no worse quality. We've seen the same thing happen everywhere where insurance ends and retail begins, areas that aren't covered by traditional insurance. Look at the cost of LASIK eye surgery, down 30% over the last 10 years. Nothing else in healthcare decreases in cost. Look at the cost of in vitro fertilization. As technology has improved, the costs have come down. We always see the inverse in healthcare. Even specialty surgeries. Look at the Surgery Center of Oklahoma, where you can get on Google and you get a price list for a knee replacement, and it's 20% of the cost of a competing institution. We see this across the board. The question tonight is about who will have the incentive to reshape pharmaceutical distribution and care delivery and move us out of a world of secret negotiations where the winner negotiates the best deal into a world where we are rewarding the best service. And normally this would be an important question, but it's particularly acute in today's political climate. Over the last 2 years, Washington has moved to defund the Children's Health Insurance Program, defund Planned Parenthood. Today, the House passed a bill that seeks to remove $1.5 trillion from Medicaid and $500 billion from Medicare. We have a court system that is set on taking away a woman's right to choose. Ladies and gentlemen, Washington is coordinating an assault on the health of women, children, the elderly, and the poor. We have an American economy and a set of incentives in retail and employer enterprises that are looking to take it back. Will Washington save our system? Please join me in voting for the motion to prove that America can save the healthcare system.
Thank you, Rajaie Batniji. And our final speaker will be arguing against the motion, Retail Alliances, Not Washington, will save the U.S. healthcare system. That is Rosemarie Day, founder and CEO of Day Health Strategies. Please welcome Rosemarie Day.
So the United States has some of the most innovative, life-saving treatments in the world. But for the 28 million uninsured Americans, those treatments are completely out of reach. And for the 82 million Americans who have health insurance but can barely afford what they've got, they are deferring care and actually not getting the care they need, which actually puts their lives at risk. So who are these people that are being left out of our healthcare system? It's actually the American workers who are fueling our economy. It's the delivery drivers who bring Amazon's packages to your door and other people in the gig economy, which happens to be one of the biggest growing segments in our economy. For those people, they don't have health insurance, and their only option for health care is to either cross their fingers or show up in the ER. So in this lack of access to healthcare, we lag way behind comparable countries. We lag behind in other measures. You've heard the other debaters talk about this, cost and quality. In fact, we actually spend twice as much in this country and we get half the results. So these measures, cost, quality, and access, those are really the measures of how an entire healthcare system is performing. And we could be doing much better in these measures. In fact, we're failing in many of them. We do need to save the U.S. healthcare system, and the question on the table is, will retail alliances save us? I'm here with Lisa, my partner, to argue that no, in fact, they will not. The bottom line is that if you want to address cost, quality, and access for all, then retail is not enough. Let's start with cost. We spend 18% of our GDP on healthcare. Other countries spend 10%. If we want to reduce our healthcare spending, retail is not enough. As Lisa mentioned, if you go to CVS, they can provide you with some convenience, and that's great, but that's not actually addressing the major cost drivers in our system. If we look at quality measures, things like hospital admissions from preventable disease or life expectancy, we lag behind other countries. It's frankly kind of embarrassing. To improve those quality measures, we really need to invest outside of healthcare into the social determinants of health. If we want to bring, in terms of access, our 100 million American workers, including those Amazon drivers, into the system, retail is not going to solve that. And why isn't retail enough? The first reason is that retail alliances are for-profit. There are really three main reasons. For-profit, they leave people out, and they don't have the scale. So in terms of for-profit businesses, a retailer's bottom line is really not society's bottom line. They are not oriented towards doing the common good. They need paying customers. They take a short-term view. They have to. Their priority is their shareholders, not what's good for society. So if you're a low-income Medicaid customer and you have a lot of different complex needs, or you're an Amazon driver in between gigs, retailers don't really see you as a money-making opportunity. And that's not to say there aren't a lot of for-profit companies doing great things, but again, their priorities are their shareholders. If we turn to employers, let's look at what they're doing. They actually leave out most of the population. They insure less than half of our population. That's 151 million people, which is a lot, but the scale of the of the employers who can actually drive change is very small. It's less than half of that. And when you look at the alliances like Amazon, Berkshire Hathaway, JP Morgan, they only cover a tiny fraction, a million of people. So providers are not going to make changes if they don't feel like they've got the people coming in the door who are really going to be able to affect that change. And I submit that employers don't have that scale. In fact, it's government that has that scale. Government is playing an increasingly large role in the role of payer, both for Medicare and Medicaid. And if we look at that silver tsunami that's coming at us, that's only going to grow. So ultimately, retailers and employers' scope is limited. Retail alliances are not enough. Washington actually has to be part of the solution. And I would submit that Washington is us. Our healthcare system is vast and complex, but it does require systemic solutions. Washington won't solve all of our problems. I run a for-profit healthcare consulting firm, I admit, and I know that Washington and government can hinder private enterprise. But I've also seen firsthand how government can work. When I helped start up the Health Connector in Massachusetts, we served as a real catalyst for change, and we found a way to collaborate. We found a way to bring industry and the government together to build a model that insured hundreds of thousands of people. We were a convener, we leveled the playing field, and we ensured equity through subsidies. So when you look at the healthcare industry, it is unique. It's actually full of market failures like monopolies, short-term incentives, all kinds of things that the private sector won't solve on its own. We need Washington at the table. So I'm excited about the debate. I'm a big fan of innovation. I think that that is part of the equation, but it's not going to address cost, quality, and access for all. For a healthcare system as vast and complex as ours, we have to have retail employers. They are necessary, but they're not sufficient. We need government at the table, and we need to see that other developed nations have actually made that successful. They provide overwhelming proof that this can happen. We don't need scattershot solutions. We need a better functioning system. So I urge you to vote no on the motion that retail alliances will save us.
Thank you, Rosemarie Day. And that concludes round one of this Intelligence Squared US debate, where our resolution is retail alliances, not Washington, will save the US healthcare system. Now we move on to round two, and in round two, the debaters address one another directly. They also take questions from me and from you, our audience here at the Mayo Transform Conference. The resolution again, retail alliances, not Washington, will save the US healthcare system. We have two debaters arguing in support of this motion, Rajaie Batniji and Gregg Slager. They are arguing that Washington is broken, that the US in too many categories is last, that the government does not know how to serve consumers, but that retail outfits do, that there are so many lessons to be taken from the online experience in dealing with choice, with care, with quality, that the retailers know how to scale, that they have multiple ways to reach customers, and not just their employees, but also their customers. They ask rhetorically the question, who really has the incentive to fix the problem and to reward the best service and do so with transparency? And their answer to that is the American employer, with an emphasis on the retail sector. The team arguing against the motion, Lisa Bielamowicz and Rosemarie Day, they say they are not arguing that Washington is the sole solution, but they are definitely saying that retail is not the solution. They say that going to a clinic such as Walmart's may be convenient, but it's just not the same thing as going to the doctor. They question the motives of these retailers. They say that they cannot scale, that the kind of medicine that needs to be delivered, the kind of healthcare that needs to be delivered system-wide is not just primary care, but really the big problems, and they don't see these companies getting interested in that. The bottom line, they say, is that a retailer's bottom line is not society's bottom line. So a lot of area of disagreement, and I want to work through some of it. But I want to go to the side that's arguing for the resolution and take to you, Gregg Slager. Both of your opponents argued that the fact that retail companies' ultimate loyalty, I think they're saying, is to shareholders, not to the health of their employees or the health of their customers, is just a fact of life. really kind of gives the lie to the whole notion that we should be trusting them to take on this job. What's your response to that?
Well, I think, first off, I think that if you're lowering your healthcare costs for your employees so you can buy more goods, she called it junk, there's a big portion of America that doesn't think it's junk and it's survival for them. I think that that's important because what you've done is you've gave them choice. You've reduced healthcare costs, which is not a choice, and you gave them choice. So I think that's important. And I think also you can look at some of the exercises that some of these retailers have gone into. CVS took cigarettes out of their store. $2 billion of sales gone overnight, too, because they want to be viewed as a health provider. And also, too, I think, they are building trust, too. I think if you think about retailers and what's going on in the market today is that they're becoming more mission-based. They're trying to build trust. And what they want that to do is they want to be able to serve more of their community's issues and problems, too. And frankly, too, I think, when we look at some of these big problems as well, John, I think, part of this is not sick care. This is health care. This is helping them live healthier lives. This is nudging them. This is helping them with nutrition. This is keeping them going. Those are the big problems. I mean, you look at diabetes and heart disease.
Actually, let me stop you there because you've made quite a few points. I just want to let your opponents respond to some of what you're saying.
If you're talking health and wellness, I mean, is CVS really interested in that? I'll agree that they waved the flag on cigarettes, but I was out in one in California a couple of weeks ago. There was still liquor and Cheetos all over the place. They are still selling those high-profit items. And I agree, giving patients, low income or high income, the choice of a $60 cash primary care visit versus going to the doctor, which if I have to pay cash for it, it's probably $120, $150, is a very important choice. But by changing that calculus, are we going to tackle the really big cost drivers in healthcare?
Yeah.
Rajaie.
If I may, Dr. Bielamowicz, you made a great point in a few pieces that you wrote recently. 4 months ago, you wrote an article titled, "Walmart will bring everyday low prices to healthcare," where you actually made the case that Walmart wouldn't just provide healthcare services in their stores, but they were going to be able to provide primary care and low-cost insurance products, steering members to preferred hospitals. You took the argument further than I would. You were quoted just 2 months ago explaining that Amazon's, and I quote, "Amazon's scale will allow them to negotiate prices in a way that the drug industry has never seen before." And you continued, "They have a company ethic of returning these kinds of savings to consumers." So Dr. Bielamowicz, I think you've made our argument more impassioned.
Right. So it's the old use the debater's words against her trick.
Well, I mean,
so go for it.
There is no doubt that these companies are going to affect change in parts of the system. It's the exact same too that I said when I was giving you my opening remarks. Primary care is 7% of healthcare spend. They are definitely going to change the way that primary care is delivered. I hope, both as a consumer and a physician, that Amazon comes in and pulls the rug out from drug companies. That's, at best, 10 to 15% of spend. And remember how much of the drug spend is stuff that actually happens in pharmacies. A lot of it is in other places. Amazon's not going to touch that. When you look at other retailers, look at CVS. What are they, in addition to being a retailer? Well, let's look at their balance sheet. $177 billion of annual revenue. $120 billion of that comes from being a pharmacy benefits manager, one of those secretive middlemen who makes tons of money off of you and me and the employers by negotiating and coming up with secret drug prices. I would argue, are they a retailer or are they a middleman when you actually look at the company?
Let's take Gregg Slager into some of that. And some of what I think your opponent is saying is that the benefits that you're talking about that the retailers may provide are real to the extent that they go, but she's saying that they touch such a small part of the problem. The resolution will save the U.S. healthcare system. That's a big, big target. So what about her basic response, and also Rosemarie Day made the same point, the retailers can't scale to the real size of the problem?
Well, I don't agree with that. I mean, if you look at the top 2 pharmacy chains, they have 20,000 retail locations amongst them. So we have 5,500 hospitals in this country. If you look at the large retailers like the Walmarts and other things, you're adding another 10 or 15,000 locations here too. So that's one thing in terms of